Thank you, Yosef, for your excellent presentation. You almost covered the distance from the Earth to the Moon. So next time you can go there. I would like to call Natasa Frangou, and she will discuss the association between the soft and hard tissue components of the human chin and other craniofacial and dental parameters.
Good morning, everyone. Thank you for being here. My name is Natasa Frangou-Timini, and I'm one of the international residents. Before I start my presentation, I would like to show you where I come from, not so far away like Ben. So I come from Cyprus. This beautiful island in the Mediterranean is my country, just 350 kilometers away from Tel Aviv. You can reach Cyprus with just a short 45-minute flight. My roots are from the occupied northern part of the island. My father comes from Belabais, Kerinia, which is in the north of the island. My mother comes from a village of Famagusta in the east of the island. But I grew up in the south of Cyprus in Limassol. This is a beautiful place that I call hometown. Today I will talk to you about the human chin and the association between its soft and hard tissue components. This is the subject of my master's thesis, which is supervised by Professor Alexander Vardimon. You all already know Professor Vardimon. He's very famous these days. And also Dr. Tatiana Sella-Tunis. Tanya is a fellow resident and a PhD candidate. And I would like to thank you both for the support and guidance. So let's start. So what is the chin? The chin is the protruding part of the face below the mouth. This is what we will be calling today the soft tissue chin. What lies underneath is the lower anterior part of the mandible, what we call mental region or genion, and we will be calling today, hard tissue chin. So we have the soft tissue chin, what we see, and what lies underneath is the hard tissue chin. There are variations in chin size, with some people having normal chin size, while others have small chin size, what we call microgenia. In other cases, people have extremely large chins, what we call macrogenia. Small, medium, or large-sized chin undoubtedly influences facial attractiveness. A normal-sized chin provides balance to the face and signals strength and beauty. In our examples, we see a politician, a sex symbol, and a comedian. The conclusions are yours. When we attempt to investigate the attractiveness, the chin size, the variations by comparing with other mammals or our extinct ancestors, we we actually discover that other animals or the other hominids didn't actually have a chin. That the chin is a unique characteristic of the modern human. But why do we have chins? Its evolutionary significance remains still unclear, with many theories including speech, mastication, and sexual selection. It makes you think if chin size and physical appearance in general still influence our judgments towards others and our self-confidence beneath our cultural development. Well, it seems that evolution has ingrained in humans certain inescapable biases about beauty and physical advantages. This is why in orthodontics, people come to us and ask for improvement in their facial appearance and in their smile and teeth. And in our field, we aim to enhance the facial beauty. Some of our approaches will sink the face in, other approaches will feel the face out. And in order to decide what approach we will take, the fullness of the lips and the protrusion of the chin play a very important role. There are some extreme cases, like the example shown here, of either microgenia or macrogenia that are beyond conventional orthodontic means, and they do require surgical intervention. Genioplasty, or chin surgery, is a procedure in the field of orthognathic or plastic surgery that is considered a simple procedure, especially compared to other jaw surgeries. There are two types. One is the chin advancement surgery. I'll show you a short video. So this is a woman with a small chin. An osteotomy is made in her chin. It's moved forward and it's fixed in the new position. And we also have chin reduction surgery in cases with big chins. A similar cut is made. A part of the chin is being removed. It's moved more posteriorly and fixed in the new position. Okay, this is a young woman that was treated in our department. These are her pre-treatment photographs. And as you notice, not only she has spaces between her teeth and her teeth are not straight, but what is mostly disturbing her facial balance is the deficiency of the chin, as well as the length of her face and her gummy smile. To meet her expectations and provide her with the best result, it was suggested to have surgery in her upper jaw to reduce the vertical excess of her lower face and the gummy smile, in addition to an advancement genioplasty to improve her profile. Here we see her lateral cephalogram X-ray. Like in the video that was shown before, an osteotomy was made in this position. It was moved forward and fixed in the new position. This is how she looked after. And by comparing her pre- and post-treatment photographs, it's evident how much this small part of the face, the chin, button, or projection, influences facial beauty. So, the chin is a unique characteristic of the modern human. Its evolutionary significance remains unclear. It plays an important role in facial beauty and it affects our treatment approach. But there are questions that remain unclear. In our study, we wanted to investigate the chin size and gender. It is commonly believed that men possess larger chins and that a big chin is a sign of masculinity and strength, while women are expected to have smaller chins. We wanted to investigate if this belief is valid. We also wanted to see if the chin grows significantly with age, if it's different in a growing adolescent compared to an adult. So if we deal with an adolescent that has a small chin, if we expect him to grow significantly during our treatment or some years later. Another aim was to investigate the association between the chin size and the relationship between the upper and lower teeth. We were wondering if a class 2 occlusion, which is what you see in the middle, is a big overbite, where the mandible is behind the maxilla, the lower jaw is relatively small compared to the maxilla, if it has anything to do with the chin, if the chin is also small, like the mandible, or not. Or if there is any relationship between the chin size and the way the teeth occlude. Also, we wanted to correlate the chin with the different facial types. Is Sarah Jessica Parker, because of your long and narrow face, more prone to have a smaller chin compared to Kirsten Dunst that has a wide and short face? This is another question that we wanted to answer. And finally, does our facial profile directly reflect what lies underneath? These are examples of some of my cases. In the first one, we see that that is the soft chin, what we could see in real life or in a photograph, that reflects directly, almost directly in a big percentage, what lies underneath. So the bony chin goes together with the soft chin. In the second case, this patient had a good size or even big chin, but we see that the soft chin, what she shows, it's relatively small. While in the third case, this patient has a big soft tissue chin with a relatively small or normal bony chin size. So this is something else that we wanted to investigate. So what did we do? We took 200 patients from the orthodontic department of Tel Aviv University, 106 female and 94 male. Their age was between 10 and 60 years old. They were healthy, with no craniofacial syndromes, before orthodontic treatment, and we used their lateral cephalogram x-rays. We used the Cephex software. We created a custom-made chin analysis. We did many measurements of the chin and other parameters. I will just show you a sample of them today. Some of the measurements that we did was the hard chin height, the hard chin thickness, the soft chin height, the soft chin thickness. We also measured the hard chin thickness effective, which is not the actual size of the chin, but what influences, what gives the projection relatively to other parameters, and the soft chin thickness effective. And what did we find? Surprisingly, when we compared male to female, we find that there were no significant differences between them. So despite the common belief that men have bigger chin, this was rejected by our study. This was about the thickness, how much it was protruded. Concerning the height, how long the chin is, in the vertical dimension, the finding was that male had a bigger chin in the vertical dimension. Regarding the comparison between growing and adult subjects, our findings indicate that the bony chin does not grow significantly after the age of 10. This was the minimum age that we included in our study. This for the bony chin. So in growing adolescent, that we usually, it's most of our patients that sick patients are around 13 or 14 years old. They're still growing. We see they have a small bony chin. We don't expect it to grow so much. When we compared the soft tissue chin, we found some changes, And this could be due to fat tissue changes that happen after adolescence or due to muscular growth. The chin height changed significantly from adolescence to adulthood. The vertical dimension, this is a dimension that continues to grow generally. It's the one that ceases growth the last. Now, regarding our question, if malocclusions that are combined with a relatively small mandible have also a small chin, in contrast to that hypothesis, we found that in some cases where the lower jaw is behind the upper jaw, a category that we call class 2 division 2, they have thicker chins compared to other types of malocclusion. And cases with a relatively big mandible, the cases that we call class 3, have a normal size of chin. Show you some examples that are in agreement with this finding. The first patient, the left side, has a big overjet. Her upper teeth are in front of her lower teeth. She has a small mandible, but she has a big chin somehow compensating for this small mandible. While in this case, where the lower teeth occlude in front of the upper teeth, and he has a relatively big mandible compared to the maxilla, his chin is quite small. So a big mandible does not go together with a big chin. And regarding the facial type, like our question, if it's Sarah Jessica Parker, will also have, with her narrow and long face, will also have a thicker chin. The results show that the longer the face is, the smaller the chin is in the horizontal dimension. So the leptoprosopic face will usually possess a less protrusive chin. Coming to our final question regarding the association between the hard and soft chin. The correlation was, of course, direct and significant, but not as high as expected, showing that there are other parameters except the mental protuberance that will result in a soft chin of a certain size. So to summarize, who is more likely to have a protrusive chin? Is it a male or a female? Well, it seems that it doesn't really matter. When it comes to age, do expect the chin of a growing adolescent to grow significantly? Not much, especially the bony chin. A short, white face is more likely to have a thicker chin, and the chin size is also related to the type of upper to lower teeth disharmony. So, to conclude this presentation, I would like to remind you that chin is a unique characteristic of the modern human. Its evolutionary significance remains unclear. Chin is an extremely important feature in the facial balance. Many factors influence chin size. The chin thickness does not differ significantly between male and female. A big mandible is not necessarily associated with a big chin. And it is possible that the chin plays an important role in the sustainment of the mechanical masticatory stresses, especially in brachycephalic face types with relatively small mandibles. So to all of you here, our families, colleagues, teachers, and friends, if you have a small chin or a big chin, I would like to dedicate this quote from Marilyn Monroe. Keep your head high, keep your chin up, and most importantly, keep smiling, because life's a beautiful thing and there's so much to smile about. At this point, I would like to thank all of my teachers in the department, the assistants, the secretaries, but most importantly, I would like to thank my family, whom couldn't have done it without them. They've been in my side all these years. my mother, Sotiroula, my father, Savas. Thank you. I would like to thank my husband, Nicolas. He made many friends in the Ben Gurion airport. Everyone knows him. Say, hi, Nicolas, here you are again. I would like to thank one of my best friends and my senior, Elena. She held my hand in the beginning, and we will always be friends. I would like to thank my fellow students, residents, and all my friends for the amazing memories. I would like to thank my junior, Georgia, with whom I shared not only the unit and the cases, but also a room during the war, and thoughts and feelings. And also Marina and the rest of the gang of the next graduates that made life in Tel Aviv much more interesting this last year. Thank you, everyone.